Hi everyone, I'm Dr. Sherry with SheFit, and this is Dr. Kim Seymour. She's one of our therapists here. And I wanted to interview Kim for you guys because she is the expert at return to running, especially postpartum. So I'll let her introduce herself, and then I have a few questions for her for the benefit of you all. So,
all right. I'm Dr. Kim Seymour. I'm a doctor of physical therapy. I got my DPT from Pacific University in 2016. And I've been working in pregnancy and postpartum work really ever since then. I always knew that I wanted to do pelvic health, so I've been doing that since my last internships in grad school. And I'm a certified running coach, and I'm also a certified CAPP-OB therapist, which just means that I'm specialized in pregnant and postpartum care. It's the only certification that exists for PTs right now for pregnancy and postpartum care. So, and I ran my whole life, so I've combined.
You were a soccer player, right?
And I was a soccer player, yes. Soccer player first, I guess, and then and so it's been my whole passion, just kind of navigating my own journey with pregnancy and postpartum, with my return to run, and then adding all of the expert knowledge that's out there to that experience to help other moms do the same.
So can you tell us a little bit about, I know you work with the APTA Women's Health Section support interest group
Yes.
for postpartum and running. Can
Yes.
you tell us a little bit about the work that you do with them?
Yeah, so I'm on the board for the Pregnancy and Postpartum Special Interest Group of the Academy of Pelvic Health. It's a mouthful. And so right now what we're doing is we're working on creating some content kind of for patients, but a little bit more actually geared towards physical therapists to help basically establish some form of protocol for return to running postpartum. So obviously still allowing for individual tailoring to the program, but when you think about it, post ACL tear, there's basically a general protocol that people go through after they've had an ACL tear to become stronger. There's metrics that we use. We expect their quad strength, their hamstring strength to be this amount before they can go to the next exercise. And nothing like that exists for moms postpartum. So we're basically trying to fill a gap in some of the research that exists where we have maybe some target metrics that we look for when we're trying to get a woman to return to running postpartum, but we don't really have an understanding of kind of how to necessarily build up their strength to meet those metrics. So that's what I'm working on, and that's what I'm really excited about, and I'm able to tap into all of these amazing professionals that are part of the academy that have been working in pelvic health for over 30 years and are really involved in the research and stuff like that. So it's really neat.
And how great that they're actually developing an evidence-based, like they do for other surgeries.
Yeah.
Because we all know as women, whatever kind of birth you have, there's really no protocols. Yeah. There's no standardized, this is how you get back to your sport, this is how you heal.
Right.
So to have people really looking at how do we do that in an evidence-based way is very cool.
Yeah.
So a couple of things I wanted to ask you for the audience out there. What is, if you can speak to this, the current evidence on return to running postpartum? Is there a lot of it or a little bit? Can you summarize it for us? And then specifically like 6 weeks versus shorter or longer? Because a lot of people think, I had my 6-week checkup, I got cleared for everything, I'm ready to run. Yeah. And we know as PTs that's not necessarily true, but if you can kind of explain if there's any evidence around at 6 weeks, before 6 weeks, after 6 weeks, what's appropriate.
Yeah, so we do have some evidence. Yeah, it's limited. It always is in pelvic health and women's health for various reasons, which we don't need to go into. But there's some good evidence. They actually did MRIs of the pelvis postpartum. This is fairly recent. I can't remember the author of the study, but they did 3D imaging MRIs of the pelvis postpartum, and they found that there was still signs of inflammation and swelling at 12 weeks postpartum. And so there was actually a study that came out of the UK by Goom and Donnelly were the two primary authors, I believe in 2018, 2019, something like that. And their recommendation is that you wait at least 12 weeks to return to running postpartum. And that does kind of line up with this idea that there's a lot of inflammation in the pelvis, even at that point in time. And the other thing that we know is that when they've looked at the levator hiatus, which is basically the area of the pelvis where the levator ani pelvic floor muscles are, if we think about the vagina like a wine glass, and then we've got the cup of the wine where the muscles are, it's that region is larger. Obviously, to have a baby, if you're birthing a baby, it needs to be larger to come out of the vaginal canal, and it remains larger for 3 to 4 months postpartum. So that's another thing that kind of lines up with that, like 12 to 16 weeks. We know that it remains larger after you have a baby permanently, but it's that new normal, right? So we want moms to be closer to that new normal from tissue healing and
and giving their bodies time to adjust to that.
Exactly.
And have the muscle build around it
right.
to stabilize it versus just going straight to a high load
right.
activity.
Right. And there's no evidence basis for a 6-week checkup. Like there's no
for 6-week clearance.
For 6-week clearance.
For running.
Yeah.
Yeah.
The whole reason why we do it at 6 weeks, there's no evidence behind that. There's no rhyme or reason. The latest that I heard from a physical therapist that I really trust is that it came out of the 60s because there was this idea that moms got a 6-week break after they had a baby, and so then they would do their checkup then. There's no reason, there's no indication from a tissue healing perspective or anything that we know about postpartum healing that 6 weeks is a time that it has to happen and that it really means anything. So
it's interesting because, as
misleading.
PTs, we study that tissue healing process, and 6 weeks is like the earliest you will heal after a muscle tear.
Right.
So usually it's 6 to 8 weeks for like a mild tear, but if you have a ligamentous strain, like a significant, like a grade 3 or 4, you're looking at 11 or 12 weeks.
Yeah.
And pushing a baby out is probably more than like a ankle sprain, right?
Yeah.
So it makes sense that you're not stable until 11 or 12 weeks.
Right.
And interestingly, I was on the ACOG website, which is the American College of Obstetricians and Gynecologists, and the recommendation is 12 weeks for return to impact.
Yeah.
So
that was a recent thing that they came out with, this concept of the 4th trimester, thankfully. But and like you were just talking about muscle tears, we know 1/3 of vaginal births result in some form of tearing to the levator ani muscles. So that's a lot, and that could even be underreported, honestly.
So it's not that you can't go back earlier, but the risk is maybe a little bit higher than people realize if you try to run at that
and really only professional athletes are going back sooner. So
some of my clients want to go back.
Well,
tell me.
I mean,
I can run, right? 5 weeks. I started running at 5 weeks after my first.
Wow.
And I did fine. I had no leakage, I had no pain, but I also knew how to grade myself into that, right? So I didn't just go. So that's my next question.
Yeah.
How does one know if one is ready to start pushing their body to that?
Yeah. That's a great question, and I don't know that we have the best answer. I think as a professional community, we're trying to, like I said, establish some parameters and some metrics that we try to hit before we start exposing someone or telling someone that they should be running. But there's some generic things, or not generic, but some general things that I think we all agree on, which is like that the pelvic floor muscle strength should be at least a 3 out of 5. That you should be able to do some amount of reps. Is 10 or 20 the right number? That's a big hot topic of debate, but some amount of single leg squats. You should be able to do, some kind of forward bounds. You should be able to handle impact, right? You should be able to do some jumping, jumping jacks, single leg hops maybe, and you're not having pain and leaking with any of those activities. Heel raises for foot and ankle control, things like that. So we do want you to meet certain strength parameters and have a tolerance to impact. Again, gradually building up postpartum during that 12-week period, so that then if you really do want to start running at 12 weeks, you've met certain strength and function parameters without having a lot of symptoms. But
and that's, I think, the key, right?
Yeah.
You might think you're handling it well, but you're peeing a little, and you think that's okay because all your friends do it too.
Because it's been normalized, but
exactly.
It's not, right? Yeah. And so, that's why we're here.
Yeah. So what do you think is the best way to go about it? If someone's already tried going back to running, they're X amount postpartum, they've already started running, and they're having a little bit of leakage or pain, what do you think is the best way to start addressing that?
That's an excellent question. I mean, I can't, if someone is determined to run, I can't prevent them from running. And so I'm probably going to try to meet them. I'm probably going to try to meet them halfway. So I'm going to start incorporating some really specific exercises, strengthening for them. And it's not necessarily just pelvic floor strengthening, but a system of muscles that I know need to work together with the pelvic floor while they're running. Probably kind of tapping into some synergist muscle groups to try to mitigate the leaking.
So to come see you.
Yes.
Is what you recommend.
Yes.
Yeah. If
Come
you're having
here.
those issues,
Yes.
go see a PT so that they can help you.
See a pelvic floor physical
Yes.
therapist, because that is not normal, even though it's often normalized in our society. And it tells us that somewhere in your body you're not able to manage the pressure and the impact and the load appropriately.
Right.
And we need to figure out where, if we can, in that system that's happening, and then give you ways to strengthen that, potentially.
The whole system.
Yeah, exactly.
So how much leakage is normal?
0. None.
So diastasis recti.
Yes.
Do you have an opinion on whether running is good for diastasis, bad for diastasis?
Yeah.
Is there...
I do. I have an opinion that it's good for diastasis, and there is evidence to support that. So,
Cool.
yes, limited evidence about diastasis. Generally, for sure, we haven't investigated every single abdominal exercise that exists and said yes, no, yes, no, yes, no. But what we know from all of the evidence that exists for diastasis is that there is not a single study that shows that exercise is bad. What we've seen is that the strategy that you use when you do an exercise versus just doing the exercise has shown greater improvement when you use a certain type of strategy, right? Which we would work with you on, teaching you how to use that appropriate strategy. And some of the studies that they looked at did include running with diastasis, and there was an improvement with running. So I think it's great. Of course, we need to be making sure that there's other parameters that we're checking too before we say, run for your diastasis.
Right.
But
is the system working well enough that that's going to improve your diastasis versus overload your system?
Yes, but it's certainly not something to fear at all. And really, like I said, all exercise has been shown to be beneficial for diastasis, and there's no reason to fear exercise or movement, because I think there's a lot of that on the internet, and I want to dispel that myth.
That's good news.
Yeah.
Right? For all of us who love running.
Yes.
So, as a certified running coach, is there anything you feel like you maybe do differently than other PTs, or things that's kind of highlighted in your practice that you maybe do differently because you have that additional training?
So the certified running coach piece kind of plays into like developing a training program a little bit more. So if you had a goal to run a half marathon or a 10K or a marathon or something like that, specific time goals that you have, or distance goals, or training for a race, which no one is doing right now because that doesn't exist.
No, there's been some virtual
in
ones.
the fantasy world. It helped me to really think about developing training programs and kind of focus on the running piece more from a coaching perspective. But there's general, things that I know as a physical therapist that I've been able to add in as far as like my knowledge of running injury, of mechanics, gait mechanics, form, all that kind of stuff that really helps, I think, enhance that coaching piece that the certification offers. That versus another just maybe triathlete coach or running coach who isn't a PT isn't going to have that depth of knowledge. So
so last question.
Yes.
What are the top 3 exercises you typically prescribe? Because we know that you have to see someone to know what exercise is best for them or what should come first. But what are kind of your top 3 favorites, like your go-tos to prepare people to return to running, especially after pregnancy?
Yeah. So foot and ankle control is super important, and foot intrinsics. I love giving runners those. I'm going to loop those into one exercise because
we like to multitask, right?
Yes. And then so that's always something that I'm including. So that might be just like a single leg heel raise, but I might change your breath strategy and maybe where your non-using leg is, how it's positioned and stuff like that. And then I definitely focus on glute strengthening because they're such important stabilizers. So specifically glute med, and we know from the research that glute med is even more important in female runners than it is male runners due to the anatomy of our pelvis and how it's different because we can grow humans and birth them. So I'm always doing something with glute med, and there's so many different glute med exercises.
What's your favorite one?
Oh, my favorite one? Why do you have to ask
If
me?
you want to work your glute med, what do you do?
Okay, here's what I do. I like to just do some single leg kind of taps with a band, maybe while I'm doing some arm work. So I'll do like a diagonal back abduction and extension.
Can you demo it?
Sure. So for in the research, they showed that you actually get more glute med activation when you put the band at the feet versus around the knees. But I find a lot of times it's harder to maintain good form with that. So a lot of times I start with a band at the knees, but maybe band around the knees, or if you're more advanced, you could do band around the ankles, and then you're just going to do a combination, sorry, I'm running into the chair, of abduction and extension, just kind of tapping the toe back. You feel a lot of work in your stance leg too, and that's normal. So you might start out with just straight leg doing a tap, and then you're going to do bent leg. The other thing that I find is really, really important for runners is a single leg squat. If you can't do a single leg squat with control, you're doing single leg squats all the time when you're running, so you need to have really good form and really good control.
Yeah,
and a really
also
good
reliant
strategy
on the
for
glute
that.
med, right?
Yeah, and it's getting glutes, so I love it in that
And
regard.
single leg balance.
Yeah, and single leg balance, yeah.
So for those of you who are not anatomists,
Yeah.
your glute med is on the side of your hip. So it's really helping to stabilize your pelvis when you're in that single leg loading state. And I think it's also good to say, when Kim talks about strategy, for those of you who aren't familiar with that term when it comes to exercise, this is how you're using the various muscles in your body and in your systems. What order are you turning them on in? And how are you using them to perform the activity? So that's one of the things in PT that, especially postpartum, we find gets lost during pregnancy, because you have to use a different strategy when your body is a little bit differently shaped. And so we need to retrain that strategy now that your body's back to its kind of pre-pregnancy shape. But yeah, great. So single leg heel raise with some variation in strategy, and then a glute med, a single leg squat, and kind of a squat with a side step.
Yeah, with abduction and extension, just to kind of really hit that glute med a little harder. So,
Awesome.
Yeah, I have a lot more favorites, but I only can pick 3, so it's not fair.
Anything else you want to tell us?
No, I just hope that every mom who wants to run can return to running. That's my goal in life. And that there's less fear around movement postpartum, because it's good for you. And if anyone is telling you that your problems are normal, then you should come and see a pelvic health physical therapist.
And if anyone tells you that they're unsolvable, come and see us. Because we are going to go down every road to help you find a way to solve that problem and get back to what you love. So Dr. Kim Seymour practices here at SheFit Physical Therapy in San Diego. I'm Dr. Sherry DeSchaff. I also practice here at SheFit. Please come and see us. Reach out if you have any questions, if you need any help getting back to anything during pregnancy or postpartum. Give us a shout. You can click our links for following us and watching us on social media, and watch additional YouTube videos that we post for additional education. Hope you have a great day, and we will see you soon.
Thank you.